Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to review the desired over have method for solving dosage calculations. And as always, whenever you get done watching this YouTube video, you can access the free quiz that will test you on this content. So let's get started. The desired over have method is a formula you can use to help you solve dosage calculations. Now there's a few other methods you can use that also help you solve dosage calculations, and that includes like ratio, proportion, or dimensional analysis. Now, if you like dimensional analysis, I have a whole playlist that you can access where I cover different types of dosage calculations and use a dimensional analysis method to help you do that. Now, the method you use to help you solve these calculations really, depends on your personal preference and what your program's requiring you to use in order to solve these dosage calculations. So in this video, I'm going to concentrate on the desired over have method. Now, with this method, you set up a formula. So you want to make sure that you commit this formula to your memory bank and let the name of this method guide you with the setup of that formula. So we're talking about the desired over have method. So that's what we start out with. We start out with D. D is the desired dose that prescribing provider has ordered for your patient. So it's going to be the ordered dose that you're going to plug in here. Then it's going to be over H, which stands for have. This is what you have on hand, what you've been dispensed with from pharmacy. So you get that information from the medication label. You look and you find the dosage strength, and that is what's going to be plugged in here. And that's going to be multiplied by the quantity. The quantity is the volume or the amount of that dosage strength that you have on hand. So that's also found on that medication label. So let me give you an example. You have a bottle of capsules, and it says that the dosage strength of those capsules is 1,000 milligrams. So that goes on the have part because that's what you have on hand. And it says that each capsule, so each one capsule has 1,000 milligrams. So you have a quantity of 1. Now this can be tablets, it can be capsules, it can be milliliters, your quantity. Then you're going to solve that, and that's going to equal X, which is the dose to be given. This is your answer. That is what you are solving for. Now, some things you have to remember about this method whenever you're trying to solve for your dosage calculation is that you need to make sure that whenever you're ready to solve that the units match up for the desired and the have part, because they have to cancel out. If they don't match, you're going to have to do some conversions, and I'm going to walk you through how to do that a little bit later on. But in order to help you do conversions, you have to have the metric table memorized. So if you don't have the metric table memorized, just take some time to look at that table and commit it to memory. So now let's solve some practice problems using this method. So our problem says that the physician has ordered 500 milligrams by mouth daily, and we are supplied with 250 milligram capsules. So we need to solve for how many capsules are we going to give per dose. So let's plug this information into this formula to solve. So the first part we need to plug in is the desired part, the D. So it's desired for the patient to have 500 milligrams. That is our dose that is ordered. So 500 milligrams. That is over what we have on hand. And we are supplied with 250 milligram capsules. So 250 milligrams is going to go here. Now that is multiplied by the quantity, and our problem tells us that each capsule contains 250 milligrams. So here, 1 is going to go. So it's 1 capsule equals our 250 milligrams. And now we're going to solve. But before we solve, we have to make sure that these units match up, because if they don't, we would have to convert. And they do. They're both milligrams, so they cancel out. So 500 divided by 250 is 2 times 1 capsule, and 2 times 1 is 2, so our answer is 2 capsules. That is how much we are going to administer to our patient. Now let's look at our next problem. This problem says that the physician orders 3.6 grams IV daily, and we're supplied with a vial that says for every 2 milliliters that we draw up, there's going to be 1,200 milligrams in it. And we're trying to solve for how many milliliters per dose are we going to draw up in this syringe to inject in the patient. So let's set up our problem using our formula. So the desired dose for this patient is 3.6 grams. That's how much they want the patient to have. It's ordered dose. And on hand, we have a dosage strength from our vial, from our medication label. It told us that there's 1,200 milligrams. And our quantity, which is in milliliters, it's a volume amount, that there's 2 milliliters in it. So equals X, and that's what we're solving for. Okay, so right here, we can tell that we can't solve our formula because our units do not match. We have grams here, milligrams there. So what we need to do is take an extra step and convert so then we can solve. So what we're going to do is we need to get this to milligrams. On hand, we have milligrams. So let's take our physician's order and convert that to milligrams. So what we need to figure out is 3.6 grams equals how many milligrams? So this is where we pull from the metric table. And we know from our memory of the metric table that 1 gram equals 1,000 milligrams. So there's one of two ways you can do this. It's really your preference on what you like to do. So to figure that out, what you can do is you can take 3.6 and multiply that by 1,000. And that gives us 3,600. So 3.6 grams equals 3,600 milligrams. Or you can do the decimal method where you don't have to multiply because it's the same exact way of saying multiplied by 1,000, but it's just a little bit more simpler. It's like a little trick. So we have 3.6, and because we are going from grams, which is bigger than milligrams, milligrams is smaller, we're going to move the decimal to the right. And we're going to move it 3 places because we're trying to multiply by 1,000. So we go 1, 2, 3, and our decimal goes here. Went from there to there. So that is the same way as writing 3,600, 3,600. So now we're converted. We are ready to solve. So we have 3,600 milligrams. That's our desired dose. We just converted 3.6 into that. To what we have on hand, so that's over what we have on hand, so 1,200 milligrams times, again, the quantity, 2 milliliters, equals X. So our units cancels out. We're excited about that, and we're ready to solve. So 3,600 divided by 1,200 gives us 3 times 2 milliliters. You multiply that out, you get 6 milliliters. And that is our answer. That's how many milliliters we're going to give per dose. This problem says the physician orders 750 micrograms by mouth daily, and we're supplied with from pharmacy with 0.25 milligrams per tablet. And we need to figure out how many tablets we're going to give per dose. So let's plug it into our formula. First, we're going to start with the D, the desired. So it's desired for the patient. The ordered dose is 750 micrograms. And that is over H, have what we have on hand. So what we have on hand, we look at the medication label, it tells us that there's a strength of 0.25 milligrams. And we're already looking at this formula and we're like, hey, we're gonna have to take an extra step and convert because these units are not matching up. We have micrograms here, milligrams there. But we'll finish filling out our formula. We're gonna multiply that by the quantity. And we know that it's 1 tablet equals 0.25 milligrams, so 1 tablet. And then that equals X, and that's what we're solving for. That's our dose to be given. So we're going to take that extra step and convert. Since we're dealing with milligrams, we're holding milligram tablets, we're going to convert the doctor's order that's in micrograms into milligrams. So what we need to figure out is 750 micrograms equals how many milligrams? So this is where we access that metric table from our memory bank. And we know from that 1 milligram equals 1,000 micrograms. So there's one of two ways you can do this. It depends on what you like to do. We can take 750 and divide by 1,000. Now the reason we're dividing is because we are going from a smaller unit, which is micrograms, hence micro, to a little bit of a larger one, which is milligrams. So this time we're going to divide by 1,000. Last time we were doing the opposite. We were going from grams, which was higher, to milligrams, which is lower. So we multiply. This time we're going from something lower to something higher. So we're going to divide by 1,000. So whenever you divide that out, you get 0.75. So 750 micrograms equals 0.75 milligrams. Now, an easy trick you can do instead of having to do all that, you can just move a decimal. So you have 750. Whenever you have that, your decimal is right there. We don't normally write it like that, but that's where the decimal hangs out. And because we are dividing by 1,000, we're going to go left with our decimal movement, and we're going to go 3 places because we're dividing by 1,000. So it would go 1, 2, 3, decimal would be there, and your number would look like this, 0.75, hence like that. So we have converted. Now we're ready to go back to our formula and solve. So 750 micrograms is 0.75 milligrams. So that is our desired dose. Our have dose, what we have on hand, is 0.25 milligrams. Our milligrams cancels out, and we're going to multiply by our quantity, which is 1 tablet, equals X. That's what we're solving for. So when you divide this out, you get 3 times 1 tablet, just bringing that down, equals X, and 3 times 1 is 3. So the patient needs 3 tablets to equal that dose that was ordered by the physician. Okay, so that wraps up this video on how to use the desired over have method for dosage calculations. And if you're interested in watching more videos about this topic, you can access the link in the YouTube description below.